Dear future DukeEngage participants, I'm Olivia Zhu, a third-year student at Duke studying biophysics and computer science. I will be working in software development after graduation and aim to go to graduate school in neurobiology.
And my name is Alex Hish. I'm a junior studying biology, computer science, and philosophy, and hoping to enter medical school after undergrad. We worked this summer with the Hospital Pietro Gamba in Anzaldo, Bolivia, with help from the Foundation for Sustainable Development. The first step in crafting our independent project was the search for a suitable community partner. We first listed out our interests and priorities. We decided early on that in order to have a significant impact in the community we visited, we would have to be able to communicate effectively with the people living there. Since we both had some experience with the Spanish language, we decided to focus our search in South America. We both had an interest in health as well, particularly health education, so we sought out organizations that worked specifically in those areas. From our search, we created a list of approximately 10 potential non-governmental organizations, or NGOs, and volunteer sending organizations, or VSOs. We sent each of these organizations detailed emails explaining our interests, experience, and the DukeEngage program. Of those organizations that responded, we eliminated those whose projects focused too heavily on clinical experience, as we didn't want that to be a part of our DukeEngage experience. Ultimately, we chose the Foundation for Sustainable Development, or FSD.
The Foundation for Sustainable Development is a volunteer sending organization based in San Francisco. While working with FSD had pros and cons, our experience with them was ultimately very positive. First of all, FSD provided us with a timeline, had us set a budget, and encouraged us to create measurable goals, such as what percentage of our project support came directly from community members. These goals helped us approach our work from a sustainable development perspective, that is, leveraging the community's will and resources, rather than providing blind service. FSD gave us two invaluable mentors on the ground, Mauricio and Cass, pictured here, who helped us with the conceptual design of our project, as well as logistical issues, like arranging a homestay and transportation. However, some could find FSD's requirements to be restricting, and we felt that we were slightly set back by the fact that FSD's host matching process precluded us from learning of our definite community partner until a couple weeks before the start of our project. This made the DukeEngage application process slightly more complicated as well.
Next came our search for a project mentor. After scouring lists of Duke faculty, we contacted a few potential mentors and met with two professors who affirmed that they were available during the summer to discuss our expectations for the project and their expectations for us. Dr. Ariely fit best as our mentor because of her experience in health education in Latin American countries, as well as her more structured mentoring style. In the months leading up to our project, we met with Dr. Ariely several times to discuss the best ways to prepare for our project. Having experience from many international projects in the past, Dr. Ariely was a valuable resource and inspired us to think about our project in new ways. Dr. Ariely asked that we send her weekly email updates about our project, which were helpful both by virtue of receiving her feedback and for our own self-reflection. This kept us thoughtful and accountable, rather than blindly moving forward with the details of our project.
Our partner community, Anzaldo, is a small rural town of 9,000 people outside of Cochabamba, Bolivia, where everyone knows one another's names and cows and lambs walk in harmony with motorcycles in the cobblestone streets. 25 years ago, Anzaldo was without water or electricity. Now, they've gained those technologies, as well as cell phone service, some paved roads, and some internet. But they still lack soap, shampoo, and hygiene education, resulting in 56% of hospital patients having preventable respiratory or diarrheal diseases.
Our community partner was the Hospital Pietro Gamba. The hospital was founded in 1985 by Dr. Pietro Gamba as a not-for-profit medical center devoted to aiding the Bolivian population, especially those living in rural locations with scarce resources. The hospital provides approximately 3,500 consultations every year and offers services ranging from internal medicine and laboratory testing to surgery and emergency medicine. Notably, the hospital is able to treat patients who speak Spanish as well as those who only speak the local Quechua language, as several staff members can communicate in Quechua, and many hospital signs and documents are translated into Quechua. Our daily work involved anything that we needed to do to learn more about Anzaldo and to push our projects forward. At first, this meant speaking with many townspeople about the health problems that they face and the previous health work that had been done there. Anzaldo is no stranger to humanitarian aid, so we were able to learn of many past projects, their successes, and their failures. As we gained more information, we began to develop work plans for our projects, and after about 2 weeks of our 8-week internship, we began the main phase of our DukeEngage project.
Our main project focused on teaching good hygiene practices to the residents of Anzaldo, particularly school-aged children. This involved 5 sub-projects, which included a survey to assess need and a summary of our work presented to the mayor to ensure the continuation of the initiatives.
We designed several kid-friendly posters to hang in places like the bathrooms and cafeteria at the school to teach and remind students about hygienic practices. We also created brochures for the hospital so that patients could learn about preventative medicine practices while waiting to be seen in consultation.
Using a design made by school children, we, along with other community members, painted a hygiene promotion mural on the wall of the public bathroom at the park. The mural and our accompanying soccer tournament greatly increased use of the previously abandoned bathroom and thus promoted better hygiene habits.
One of the greatest health problems our community partner identified was recurrent head lice outbreaks among school children in Anzaldo and surrounding communities. Therefore, we traveled to several of these communities to give workshops on head lice treatment and prevention, while also supplying the necessary materials for the communities to perform delousing. Near the end of our project, we presented the mayor of Anzaldo with a report of our work and a cost-benefit analysis with recommendations of ways to continue our projects into the future.
In day-to-day work, we often had to reconcile our vision with that of our supervisor. For example, we originally wanted to focus on hand washing, but our supervisor wanted us to continue previous work on head lice, so we combined the two. In communicating, Spanish was a challenge to start, but on top of that, some of the residents exclusively spoke Quechua, a native Bolivian language. Without a reliable translator to Quechua, our education program was certainly less effective in that population. Additionally, the pace of work was slower, and I personally struggled with being less respected professionally as a woman in a culture of machismo.
Perhaps even more important than the service we were able to provide to Anzaldo was what we were able to learn from our experience. Living in a small rural town with fewer resources and a simpler lifestyle than we were used to here in the U.S. taught us a lot about how to reduce our resource usage to be better stewards of the environment, and also how to appreciate the simpler joys in life. On a less positive note, we also learned the difficulty in trying to motivate people to change their health behaviors. When unhealthy habits are built into a culture or normalized, as some were in Anzaldo, they are incredibly difficult to change even when the people know the dangers of such behaviors. This problem is exacerbated when the proper resources are not available to maintain healthy habits.
We also learned that in sustainable development, you really need to listen to your host community, what their needs are, what resources they have, and what initiatives they would like to implement. They must be the ones to effect change, not you, no matter how confident you may be in your own abilities. We learned to make very achievable goals, accounting for every possible problematic detail, and to make a plan B and a plan C. Please feel free to contact us with any further questions. We would love to clarify any doubts or hear your ideas for your own projects.
Thanks for listening to our presentation. We wish you the best of luck with your project.